Mission and margin is the business of healthcare. Thanks to our sponsor MedChat, providing live chat, bots, and text tools for a modern digital front door. See medchatapp.com. Mark Jannone, thank you so much for joining the business of healthcare today.
Oh, thank you for having me here.
You've had several projects that you've rolled out focused on the whole consumer experience around emergency medicine, emergency department. Tell me a little bit about those projects.
Sure. So the reason why we wanted to focus on the ED care is that I think most organization notices that a lot of care that comes into the ED should have been treated at a lower acuity facility. So taking that into account, one of the projects we have is a digital triage tool. And this digital triage tool asks specific questions of the customer with 92% triage accuracy. So from these questions and their responses, the AI tool would then determine whether or not a primary care appointment is warranted, and from there, right from the app, you'd be able then to schedule your primary care appointment. You can do a telemedicine visit that's launched right from the app as well. You can also, if urgent care is the appropriate site of care, it will tell you what the closest urgent care center is, and in certain instances, if it happens to be a Banner location, you can then check in at that point. So you'll put your name in the queue right at that point as well. And sometimes ED is the appropriate level of care, and we'll also let you know that. And we also have a tool that then will take over from there, and what that tool will do is that you will start the pre-registration process at that point. And from there, when you start the pre-registration process, even though you're not in the ED at that point, it will put you in the queue as well. And it'll tell you the directions to where the facility is, it'll tell you where to park at the facility, and show you pictures of the outside of where you should be entering. And from there, that alone, on some of the tools, we've decreased the amount of time in the ED from start to finish from about 50%. As well as with the previous tool that I talked about, with the triage tool, we have a 35% reduction in inappropriate ED cases.
So those are some really, really big numbers. 92% triage accuracy. Tell me a little bit more about what that means.
Well, it means that it's the appropriateness of where people should be going, and there are specific protocols that we employ in order to determine what the right site of care is, and it's really based on those questions. Those are questions that will really help. It takes about 2 minutes, I believe, to fill out those questions, and from there, that gives the AI tool enough information to determine based on your responses, where you should really be going.
A 50% reduction in cycle time, even if it's just that wait time, that's an enormous, I mean, I perceive that that's the biggest complaint in ED. I sat there and waited forever.
Exactly.
What feedback have you gotten on that?
We get a lot of great feedback from our customers about some of the products that we roll out, and one of them as well, when we're talking about waiting, is our chatbot tool. And what our chatbot tool is, as you talked about waiting, and waiting is obviously something that's concern to our patients as well. And I think the biggest complaint that not just our facilities receive, but I think all healthcare facilities, is that people will ask, how long do I have to wait? I've been waiting here a while. Nobody's communicating with me. So after they come into the ED and they have this tool, and they'll automatically start getting text messages to let them know, you have 15 minutes, about 15 minutes waiting time, or within a certain range of waiting time. And then even after they see a provider, whether it be that they need to have lab work done or imaging work done, it lets them know where they are in that process and how that process is going as well. So it's keeping our customers well informed throughout their stay, and from that, we talked about NPS before, we've seen a 40% improvement to NPS scores for people that have utilized our chatbot tools as well. And at the end of the treat and release patients, it gives them a link to our portal. So then now, right from their phone, they'll be able to, if they have never used our portal before, they can register for portal access, as well as when they go into the portal, they'll know what their results are.
Tell me a little bit about your role and responsibility at Banner.
Sure. My responsibility is that I am the Senior Director of the Banner Innovation Group, and what we're responsible for is anticipating our customers' future needs, designing new solutions, and changing the future model of healthcare.
And that's a big change for you.
It is.
You left of many, many years at a large health system on the East Coast to a year and a half ago come out to Banner. What led you to make that change?
I think it was just the future thinking and the forward thinking of Banner, really, and that they put their money where their mouth is about innovation. You know, a lot of organizations talk about innovating, but don't really spend the resources in order to get that done, and Banner is actually doing that. So they are very forward in the way they're thinking about innovation, and innovation is a strong part of what they do. And as part of our core values, one of them is courageously innovate.
When you think about the innovation platform that you lead and play a role in, what are the components of that?
The components of that are that we have the Innovation Lab, and the Innovation Lab is our main work stream that uses an empathy-driven design cycle, which would prototype, test, as well as prove future solutions. We have an innovation arm, that's our Banner Venture Group, which sits inside of the Banner Innovation Group, and that's our vehicle for investing in venture capital funds, as well as directly investing in early stage companies, but more importantly, it's our eyes and our ears for innovation outside of healthcare, so we can bring in other organizations that may not operate in the healthcare sector in order for perhaps that we would use them, our Banner Innovation Group would use them, or our colleagues in other departments would use them. And lastly, the other function is how do we change the culture of healthcare in our organization? And we do that through sharing our strategic imperatives and our forecasts, our trending, as well as training and how we collaborate internally with our colleagues. We work collaboratively with our digital business team, who's responsible for modernizing and advancing digital experiences to meet the customer's engagement needs.
So innovation is always driven by solving a business problem. Mm-hmm. When you think about the business problems that you're chasing, what are the 2 or 3 most interesting ones that you're going after?
I think it's how do we reach new markets, really, and how do we build our business, our market share, and creating that loyalty so that we have customers that are repeat customers for us and not just coming to us one time. So I think that's going to be what really marks success for us.
And so new patient acquisition
Mm-hmm.
and patient retention.
Correct.
How do you measure that?
That's hard to measure. That's very difficult to measure. And one of the things that we're doing right now is, for instance, our NPS scores. Mm-hmm. So our NPS scores is not a new concept, but relatively new in healthcare. There's a lot of strong correlation between higher NPS scores and business growth. So what we like to say is that promoters renew. So for those people that are promoters, they're going to stick with you. That drives loyalty. As Banner grows, our customers grow along with us. Promoters forgive. You know, sometimes you have to do service recovery, but if you have those strong connections with your customers, they're willing to forgive things that sometimes may not go the way they originally planned. As well as promoters promote. And word of mouth is key in marketing. It's the holy grail.
Tell me about the future. What are the things coming down in the next months or year that projects that are coming that you're most excited about?
Sure. There's one right now that we're in discussion phases. It's very early at this point, but really it's how do we use nudging technology in order to change behaviors of patients. So I think our target audience in this is going to be those people that have either gone through bariatric surgery or diabetic patients, those that have dietary restrictions. So the way we anticipate to use this is that we would have this app in the on their smart device, mm-hmm. and as they enter specific restaurants, and especially those restaurants that have their menus online and nutritional information online, the location-based services will know that they entered these restaurants and suggest those appropriate or alternatives of what they should eat at those restaurants based on their dietary restrictions. We are in a market that has, or anticipating double-digit growth in the OB space. So for that, one of the things we're doing for Moms to Be right now is developing a digital tool in partnership with another organization in order to personalize messaging that they're going to receive, so what to expect on a weekly basis, personalized to them. There's personalized education that's going to be done right in the app that's accessible. There's also part of that, there's a care navigation tool or module for that. So what it will do is that we'll nudge them, for especially those that are high-risk pregnancies, not to miss their appointments. And there's the capability of remote monitoring, specifically for blood pressure, using peripheral devices.
So you use the term nudge.
Yes.
I think that's a really interesting term. Talk a little bit more about that.
So there are other organizations that really specialize in nudging technology, and there's a lot of analysis and research has gone into how do you message to people, and people all react in different ways to different types of technologies and the way the communication is sent to them, and how do they change their behavior. This is something that's relatively new to many organizations, I think, in the healthcare world, but there are other organizations that we're partnering with that specialize in this.
What comes next in your work in ED?
So what Banner's looking at is right now is we finished a pilot that has to do with virtual care within the ED, and this is targeted to patients with very low acuity. So it's really more of a fast track for them. So as they enter the ED, rather than waiting to see a physician, they will then see a physician virtually at that point in time.
So I'm physically at the ED,
correct,
but I'm going to have a virtual encounter.
Correct.
And is it a separate room that I go into, or?
It is a form of an exam room that you will go into at that point in time.
So is the idea that you've got a load balancing opportunity there. One doc sitting in a call center format,
correct,
can be servicing those low acuity patients across multiple EDs.
Correct.
Got it. Okay. So enormous ROI. You've optimized the labor hours for that clinician.
Yes.
Mark, really, really exciting work. Thank you so much for joining the Business of Healthcare today.
Well, thanks again for having me, Matt.
Watch, listen, or read Business of Healthcare interviews at bohseries.com.